Prostate cancer is again one of the most common conditions seen these days, and in fact it is seen that the incidence of prostate cancer is more these. It is not because the disease chances are increasing, but because of the very early pickup rate that is seen. With more and more patient awareness, more patients in this middle age group, they have the symptoms and they go to the clinician, and by a simple investigations, a simple clinical examination by doing a digital rectal examination is also called a rectal examination. It is in fact a test where the clinician just passes his right index finger into the rectum of the patient, and he can very easily feel the prostate, and any sort of difference in the feel, the consistency of the gland, we always have the suspicion of a prostate cancer. And now again we have the transrectal ultrasound, where we use a high frequency probes of around 7 to 10 megahertz, and the prostate gland can be very easily imaged, and based on the echo texture of the gland that you see in the screen, we can always raise areas where a patient could be harboring a malignancy. And again, using these probes, we can always take a targeted biopsy. Now the word targeted biopsy means you can exactly pinpoint where exactly is the area of suspicion, and you can take a small chunk of tissue from that particular area, and this can be subjected to a detailed histopathological evaluation, and again the diagnosis is there quite early for you. Another important thing is we have a simple blood investigation called the PSA, or the prostate specific antigen. The normal value is 0 to 4. So the moment you have, now these days, as part of the routine master health checkup program for all hospitals, they have a PSA evaluation as well in any male over the age of 45. So if the PSA value is more than 4 nanograms per ml, you always do a transrectal ultrasound, and you can take multiple biopsies.